All right. Well, good morning, everyone. I want to go ahead and get this webinar started. Uh, Today, we wanted to talk to everyone about the Day One Family Funds. This is part of CCS's commitment to serve homeless families. It was a great opportunity, a great initiative, and we wanted to let everyone in the agency know what we were doing with this program. All right, it worked. So today we're going to review a little bit about the program history. I want to do an overview of the funding, talk about some key opportunities and what our vision is for the future. We'll talk about what ways we can receive support, what would be most beneficial. And then we'll leave some time for an open discussion for everyone. Go ahead and to do an introduction. My name is Terrance Watkins. I am the Executive Director of Housing and Medical Respite Services for Catholic Community Services of Southern Arizona. Jody, do you want to go ahead and do your own introduction?
Thank you, Terrance. My name is Jody White, and I'm the Regional Director for Domestic Violence Intervention and Prevention Services.
Thank you. And also, we have Avita Mendez-Counts. She's the Executive Director for Yuma, but she was not able to join us today. We have if as you see it where it says contact for, if you needed any information about CLP, the Medical Respite Shelter, transitional housing, senior housing, or our Medicaid billing services and programs, I would be the contact for that. For domestic violence, for Jody, you would contact her for domestic violence intervention, prevention programs, domestic violence shelters, our rapid rehousing and transitional housing in Southern Arizona. For Avita, you can call her for anything, but she's mainly over Yuma in Southern Arizona. Also, she does quality and corporate compliance for the agency. To give you a little bit of history about the Day One funds, in 2022, CCS received a grant from the Bezos Day One Family Fund to help end homelessness for families in Southern Arizona. CCS allocated funding for a lot of different projects, but it was to renovate existing and purchase additional housing units. We were able to purchase vehicles to serve the families. We were able to fund key staff positions, and it provided funding to provide subsidies and diversion funding for families experiencing homelessness or at threat of homelessness. If you don't know what diversion funds is, that would be if you have a family that experienced a single episode of financial insecurity. Their vehicle broke down, death in the family, and they weren't able to make their rent payments or their utility payments, and they were in danger of being homeless. This is the stopgap that would be able to prevent them from entering our homeless system. Most of the services have been provided by CCS through the Pio Decimo and the Yuma programs. In collaborations with communities that we serve, for the second year of the grant, CCS has partnered with local coalitions to end homelessness in Yuma, Santa Cruz, Cochise, Graham, and Greenlee counties, as well as with the Tucson-Pima Coalition to End Homelessness, to ensure that these funds are available to all residents in Southern Arizona. Sorry about that. All right, so population. In order to qualify for these funds, individuals have to it has to be a family, and a family is defined as having at least one individual in the household under the age of 18. That is really the only requirement, that, and they are experiencing or an imminent threat of homelessness. As far as staff, the program operates in multiple locations clear across the state. But for case management staff that are specifically assigned to this, there's 1.5 staff members in the Sierra Vista Douglas area. You have 1.5 staff allocated in Yuma, and there are a total of 4 staff members that are allocated in Tucson. When we were talking about other providers, we were trying to see who other providers that were doing this service in these areas, and that's kind of the point of the program. Is no one was. This is a big gap in these communities that without these funding, these individuals would just continue to be homeless. Individuals leaving the DV shelters we didn't have a continuum for them, so a lot of times they would return to the previous situations. So this really was a gap throughout all of Southern Arizona. So we are the only game in town that are doing it. So I want to give you we'll move on now to the program outline. This program is the result of grant funding received from Bezos. The grant included $5 million budget to be spent in 2 years. I know a lot of people say, oh yeah, that's easy. No, that's not. That's a lot of work to spend $5 million in 2 years on program specific expenses. That being said, we were able to do a lot of stuff with it. We were able in Southern Arizona, we were able to add transitional housing to the Yuma and Cochise County domestic violence shelters that we have there, allowing individuals who are fleeing domestic violence to rebuild their lives in the safety of their own homes. As I said before, and I'm not going to lie, this is anecdotal and I got it from Jody. A lot of individuals who came to the program and they were here for a while, they didn't have income, they really had no other place to go, and a lot of times they would return to the previous situation that they were trying to flee. But this gives us an opportunity to have housing for them so that they can find a new job, start working. Because they have shelters across Southern Arizona, they can move them out of that community into a new community where they can start to rebuild their lives. By November of 2024, we're working on being able to open our first tiny home community in Sierra Vista, which will support the domestic violence shelter that we have down there. With that completion, that means all of our DV shelters will then have transitional housing attached to them. In Pima County, we renovated 14 two-bedroom apartments and 6 3-bedroom apartments for families, and it's transitional. I'm not sure what you know about housing, but historically transitional housing has been tapering off. It's no longer available. HUD moved the funding elsewhere. So it's really imperative that we have in our communities a place that people who are not chronically homeless, but I just don't have enough money. Me and my family are headed towards homelessness right now, or we're doubled up, tripled up in a household with 3 families, and we need a way to rebuild our lives. So this it gave us the opportunity to renovate all of these apartments, and so we'll be able to continue on with the program for evermore, hopefully. But one of the coolest things about this is this funding actually provides we call it a shallow subsidy of $704 a month for every family that is living in any of these transitional housing programs in Pima or through Southern Arizona. To put that into context, and let me see if I can open the calculator real quick, because open it on the screen. If the rent that we're charging for a 1-bed or for a 2-bedroom apartment is $1,150. If you subtract the $704 subsidy, that means that a family that needs to have a 2-bedroom apartment is only paying $446 per month for their rent. That makes their rent super affordable. And we'll talk about some of the other financial inclusions to the program that will help them in their homelessness. All right, I did skip it. So participants in the domestic violence shelters are provided safe shelter, clothing, personal care items, case management, connection to community resources, educational resources, employment, and healing supports in a trauma-informed care environment. Participants that are in our transitional housing program, they receive financial literacy classes, individualized financial coaching, in addition to the services above. All participants are eligible to receive housing counseling. Housing counseling is a program that we have through our home buyer program that will assist them in being able to apply for and get down payment assistance for first-time home buyers so that we can help move them into their housing. Part of that $704 a month subsidy is that participants will, when they're meeting with their housing coach or their financial coach, I'm sorry, they show proof that they are saving 10% of their adjusted net income every month. They also have to show proof that they're putting 10% of their adjusted net income towards a debt identified on their credit report. And it's all for the purpose of, when an individual leaves our program, if we can get you a median credit score of 640, and we can, median credit score is 640, $2,000 in the bank, and if you have 2 years of verifiable employment, we can get you down payment assistance and help move you into your own home. And that's when we shoot for the stars in the skies. But even if we fall short of that, when the individuals leave our program, they will have money in their bank account. They'll have a better credit score. Any car loans or any loans that they need to do, they'll get more favorable interest rates. And it just sets them up to be more financially stable when they leave our programs. All right. So some key opportunities and vision. Obviously, of course, we want to decrease and prevent homelessness. CCS increases available resources and opportunities for families experiencing homelessness and domestic violence throughout Southern Arizona. As we said before, there is a real gap in services, especially around families and being able to move you into housing quickly. So it's really awesome in that effect. Additionally, we were able to, with the partnership with the local coalitions to end homelessness, we were able to actually make sure that anyone in Southern Arizona who is on the verge of homelessness can receive the diversion funds as well. We want to improve the participant stability. CCS provides services to improve the socioeconomic status of participants by addressing their social determinants of health. When you come into our program, you might be where you're at because you have low income. You might be where you're at because you have a job that doesn't pay much. Each one of these programs has case management staff that will work with you to get a new job. We'll get you enrolled in school if we need to. We'll help you complete your FAFSA. We'll get you a certification. We'll help you find better employment. That's the whole purpose and goal of the program, is that when you come in here, we're going to address everything. We're going to be doing comprehensive assessments with individuals, which will be the driver of the individualized service plans that we will work. And that is the roadmap for the work that we do with the participants in order to improve just everything. I want to look at you holistically and address any services that you have, any needs or concerns that you have going on. And lastly, we want to increase home ownership. By increasing participant income, addressing debt, increasing savings, we assist the participants with securing down payment assistance to achieve home ownership. Currently, we have 2 grants that we are working with in Pima County to secure down payment assistance for program participants. We've had a meeting with the United States Department of Agriculture. I know, I just thought they inspected beef, but no, they build a lot of houses. They do a lot of housing services in rural Arizona. So we're trying to enroll in 3 of their programs. So that way we'll be able to help individuals throughout Southern Arizona buy housing, and not just in Pima County. But the overall vision, we want to strengthen these programs and continue to expand them throughout all of Southern Arizona. I don't want just transitional housing attached to our properties and attached in Pima, but we would like to open them up throughout Southern Arizona. We want to incorporate behavioral health services into each housing program. As a matter of fact, we are going live on Monday. Monday will be the start of us incorporating behavioral health services into all of the services that we do. And then we want to document outcomes because we want to be able to advocate for additional funding to support this model that we have. So how can you support it? In 2015, the HUD, the United States Department of Housing and Urban Development, began redirecting all funding away from transitional housing in favor of rapid rehousing. I'm not sure if you've heard of the term housing first, but they said we need to just put them into housing and roll with it from there. Work with them, try and get them to participate, and we'll see how it works. Transitional housing itself, I'm transparent, Terrance, so I'm just gonna talk normal. I was homeless and I came through transitional housing, and I was able to get the supports that I needed for my family. I was able to get employment, bus cards. It was amazing. It was an amazing opportunity for me to be able to move forward quickly. Transitional housing is just that. It's transitional. It's not long-term. You're going to come in here and we're going to help you get where you need to be so that you can move on. And in doing so, we can move participants through the program quickly, and we'll be able to better meet the needs of the communities and actually have openings and availability and, weird, strange things like that. But we intend to capture the outcomes of all of our programs. We want to know when you came in, this is where you're at financially, this is where you're at medically, this is where you're at in all of the different social determinants of health. And we want to show where you were at when you left our program. And we want to capture these outcomes to be able to advocate for more of this funding throughout the state. As far as donations, all of these families that are moving into our programs and then moving out into their own homes, they will always need housing, cleaning supplies, hygiene items, linens, school supplies for the kids. We do get donations and we are able to provide some things, but these are typical items that you cannot purchase with food stamps. So that's that little gap in between where I'm at and where I need to be. Other program participants are hardworking. Their families, I know that there's a lot of stigma around the homelessness, and they say that people are just hanging out and they don't want to work. I'm here to tell you that's not the truth. They absolutely do want to work. They want to work a livable wage. Getting a job at minimum wage where I work 15 hours a week, that's not going to bring them out of homelessness. It's not going to help improve them. And then the individuals who are escaping domestic violence, when they're rebuilding in these new communities, they absolutely need a new job. That is probably the single most important metric that can make or break a person's launch. So any employers, if we're able to connect with any employers that are willing to hire these participants, that would really be outstanding. I made it. All right. We're at the end of the presentation. And now it is fully open and ask away. I will answer any question that you throw at me.
Hi, Terrance. This is Carrie from Sierra Vista. I'm new to the company. I just had a question. How do I get an individual help with housing? Where do I go? What website do I go to?
In Sierra Vista, you can join us on the 5th, and if you shoot me your email and the text, I'll make sure that we include you, that you get an invite for the meeting that we're gonna have in person on the 5th in Sierra Vista. And I'll get you connected to every resource in your county.
Awesome. Thank you.
Got it.
Terrance, this is Mary Andrews. Can you hear me?
Yes, ma'am, I can.
Wonderful. Okay, I know that Mosaic on Silver Bell and Grant.
Mosaic Cafe.
Yes, Mosaic Cafe is hiring. I also know that Bob's Breakfast, I just went there this morning and they're also looking for help.
Okay.
I'll let you know if I hear of any more.
All right. And maybe we can, like I can send out an email with the assigned person who can compile all of this, throughout the state. And that way, well, throughout Southern Arizona, that way we would have these resources, compiled for everyone.
Right, right. That'd be much help, I think.
Hi, Terrance. This is Anna.
Hi, Anna.
How are you?
All right, and yourself?
I'm well. Hey, I love hearing all this. I'm really excited. You had a wonderful presentation. I just want to make sure that we also know that, there's a lot of collaboration between housing and refugee resettlement. And so if anybody knows of jobs, please send them my way also. Maybe Terrance and I can work together on that, because as refugees arrive, many of them are struggling with housing and are struggling with getting a job, and some are homeless. So don't forget about refugee resettlement for us to also be part of the employment and the housing piece.
Absolutely.
Thank you.
Anna, you still on, Terrance? I gave this information to Elvira, Anna, that Mosaic is hiring.
Perfecto. I love Mosaic.
Yes, me too. Me too.
I'm
Okay,
hungry.
so hopefully he has a lot of people from Honduras there, and they're wonderful people.
Perfecto. Thank you.
Uh-huh.
Terrance, this is Tony. I had a question for you.
Tony.
Looking at all of these services that we're going to be providing as CCS, but also coordinating with other entities providing similar services or complementary services or things we just don't do. It seems like our case managers it'd be quite a challenge to be managing all of those needs with multiple people and multiple organizations. Can you comment a little bit on how you see that working, or if there's any tools or things we need to put in place to facilitate, that kind of communication and coordination, or maybe I'm missing something?
Yes, sir. Absolutely. Well, one is caseload size. We have to make sure that the caseload size are reasonable and manageable. I can't expect you to have a caseload of 100 people and that you're going to do great work with everyone. It's also location. So Jody's team is responsible for all of the services in the DV shelter. I have teams here in Tucson that are responsible for those services here as well. So it's all about caseload size, making sure that they're manageable, readily accessible. And if one staff member over the course of 12 months can do really great work with a caseload of 20. So that's how we, one, make sure we're able to provide those services. Secondly, it's through program development. Each property, each program needs to have clear outlined guidelines, and this is the standardized protocols that we use. These are the vendors that are local in our area. Whereas the recommendations for Mosaic Cafe and Bob's Breakfast, that's great for Tucson, but I need to also build that in Yuma and Sierra Vista and Douglas. So that's where that comes in. The company is moving towards a platform called Unite Us. And right now I'm in the process of making sure that all of our programs, not just these, are accessible through that. But the case managers will also be able to go in to Unite Us and find pretty much any resource that they need and be able to submit applications for them there.
Yeah, well, thank you for bringing that up because that was one of my thoughts is that Unite Us really was designed to incorporate into that exact problem set. And it can request services, you can respond to a request, and it also tracks progress. So yeah, if we could make that happen, I think that could be a very valuable tool for all the people and the teams that you have.
Yes, sir.
Great.
And I would like to say, Tony and Terrance, that the domestic violence shelters have been using Unitas. And so all of the participants that have come through the shelters, as well as all the participants that have used Day One funds, have already been entered into Unitas. And we do receive those referrals and interview with those participants. So it does work wonderfully.
Oh, that's
And we've
awesome.
been doing it, well, first it was named something else, but we've been doing it for nearly 2 years.
Yeah, I was aware that you had, well, you guys started, you led the whole United Us effort for us.
Yes.
As part of that, are you doing the assessment also?
Yes, we do.
That's terrific. Thank you.
Thank you.
I like leaving the odd silence to see if anyone else wants to.
Terrance, this is Elena, Jody, and Evita. Just want to say congratulations for such an amazing program. I know this is just the beginning, and we are all very excited and looking forward to what this is going to look like a year from now. This is a very comprehensive program that not only focuses on housing, but wrapping around our clients and families with services. So I just want to say congrats to all of you, because this is going to be a wonderful program, and it's just going to impact our communities in a way that's incredibly needed. And it goes beyond Tucson. We're focusing on expanding in Yuma, Sierra Vista, Cochise County. So very, very excited, and looking forward to seeing how the great work that you guys are going to be doing. So congrats.
Thank you, ma'am.
Thank you.
Last
Hi,
call. Oh, go ahead.
Good morning. My name's Narelle. I'm in the Family Connections program under Child Welfare. And in thinking about your transitional housing that program, what's like the time frame that participants are involved? And are you guys taking into effect with your trauma-informed care whether they're really ready to start making those changes and do the saving and do the tough work of aligning or getting up and running with a behavioral health or a substance use provider? If they're not ready for those things, are they still able to participate in the transitional housing program, or is it something that they're going to be disqualified for, I guess, for lack of a better word at this moment?
So I'll answer the first question. Programmatically, there you go. That sounds a lot better. It's 12 months. That's the time frame that we have to work with families to get them from point A to point B. In Tucson. Jody, what is your time frame in the DV programs?
It's 12 months also. And I would like to say that even if someone is not fulfilling or maybe achieving a level of sobriety, that's what we do, is to assist them in that recovery process while they are in that transitional setting. So we do an individual needs and service plan with every single person that comes in. And so we're willing to work with them where they're at. So as long as they're willing to work on themselves to better themselves and gain that financial responsibility and self-sufficiency, then we're willing to put in the effort with them.
This is Laura. I have a question. If they went through the program and weren't ready, can they come back at a later time?
I don't have any problem with an individual family that reapplies to come back through. Sometimes it doesn't stick the first time. It's
Right.
We made a lot of great accomplishments, but life just didn't work out the way we planned. So yeah, I would have no problems with returning.
Is there a time limit in between? Just availability back on the list?
On availability.
Yeah.
And the transitional housing here that's not attached to the DV shelters, it's a greater wait list, much longer because there's a lot more people who are trying to get in. But you came through the program, and ideally you bought a house. If you didn't, the whole purpose of having them save their 10% of their adjusted income is to create that financial buffer that would help prevent them from falling back into homelessness. But to Norel, to your second portion of the question, the amount, when I said adjusted net income, the 10% of their adjusted net income is what they need to save, and 10% of their adjusted net income is what they need to spend towards paying down debts. That is, you got a paycheck and then you had to pay rent, you had your phone, you had your car, you had gas. It's taking into account all of the other expenditures in life. And then out of what is left, so that's why it's your adjusted net income. Out of what is left, that is what 10% of that is what you need to start paying towards these expenses. Does that make sense? So that goes back to what Jody was saying with meeting people where they're at. Because if I got a paycheck my paycheck was $1,000, but my bills were $700, I can't afford to put $100 towards savings and $100 towards paying down my debt, because that would only leave me $100 left out of my paycheck.
Yes, thank you. And within that, are utilities included in the housing options that we have through those apartments?
Yes, ma'am.
Terrance, this
High-speed
is Anna
internet
again.
available? High-speed internet?
I don't know about internet. I'm not gonna lie to you. I'll look into it today because you stumped me, so I will look into internet and see where we're at.
It's
I have
helpful with
the
job
answer for
hunting.
UMass. The answer for UMass is yes, we do pay for internet.
Perfect, thanks.
Hi, Terrance, it's Anna again.
Hi, Anna.
I also want to say, for these people with, talking about their income, we do training through the low income tax clinic as well as the volunteer income tax assistance program. And we can, many people don't understand the difference between the 1099 NEC compared to what is a W-2, what to think about throughout the year, make sure your deductions are properly, addressed with your HR department. And so when you get those people into those counseling sessions or just on a one-to-one basis, we're able to provide that type of tax education as well as tax preparation.
Any other questions?
You better get to work.
Sir, I work in my sleep, sir. This is all we do is just work.
That was a great presentation. Thank you.
Thank you, sir. So I want to thank everyone for joining us. My name, contact information is on the screen as well as Jody's. Please don't hesitate to give me a call. I'm in a lot of meetings and I'm always running and gunning, but if you leave a voicemail, I absolutely will call you back same day. Unless it's 4:59, I might have to wait until the next day.
Thank you. Yes, reach out if you need anything.
Thank you.
All right. So I'll leave this here for a couple more seconds. Our list of upcoming webinars, I will put on the screen next, but our next one will be on June 28th, and it'll cover aging and vulnerable populations.
Thank you, Terrance. You did amazing.
Thank you, ma'am.
Yes, you did. Thank you so much.
Well, I thank everybody for joining us. Please feel free to reach out if you have any questions.
Have a good day. Thanks, Karen.
Bye, everyone.
Bye.
Have a great day.